Hi, everybody. My name is Melinda. I am a licensed mental health practitioner. I'm a licensed alcohol and drug counselor and a licensed professional counselor. I have my own private practice where I see clients individually. I also complete evaluations. The purpose of me making these series of videos is just trying to encourage people who may struggle or have barriers for reaching out and seeking treatment or seeking some kind of counseling that they're needing. So I want to talk about today was what to expect during your first counseling session. And this, I guess I can't say this applies to all counselors, but this does apply to me on what to expect. I think it gives you some insight. Initially when people prior to coming, I will send them an email which has information. Normally it has my informed consent information, and I will provide that so people have a chance to actually read through it because it's about 4 pages long, and I want to give people the opportunity if they have any questions, so we can go through it. If they don't have a chance to, a way that I can send them the paperwork, normally they come in and, my first priority is to go over this because it's so important. And I think that you need to have, that knowledge before you start counseling. And that's just part of the process. So normally when I have new clients come in, I kind of get them two different people. I get the people who are just so overwhelmed, and you kind of get this like emotional dump of, what's happening in their life. Or I get people who are more anxious and they're more reserved and more quiet. And those are the people where maybe you need to spend some more time building that relationship, building that rapport, and making sure, that they feel comfortable with the therapy process before they really can open up and share. So a big thing I want to talk about is the informed consent. So I want my clients to be informed about therapy, what to expect, what does it look like, the process, how do I keep records, HIPAA, confidentiality, terminating, what gets reported. That's a lot of information. Um, and I think it's good that clients are fully aware. Essentially, I'm going to talk with clients. I'm going to, give them some background about who I am, what I've been doing, how long I've been doing it, the counseling process if they've never done counseling before, what to expect. The big thing with counseling is that I want my clients to feel empowered and that they need to identify their goals, the things that they think is important to address. So a lot of times I'll say, what are things that you want to work on in here? And clients sometimes are like, well, I'm not really sure. I'm just, I'm overwhelmed right now. There's like a lot of stressors. So maybe I say, do we want to address our mental health? Do we got some depression? Do we have some anxiety going on? Do we have some trauma history? Do I have problems in my relationships? Am I struggling with my alcohol, my substance use history? Like there's a lot of things that go on, and to identify those is kind of one of the first steps. Okay. Um, we talk about kind of the basics of, you cancel appointments, how things, um, your right to privacy, confidentiality, HIPAA. And I don't know if a lot of people really understand, what goes into that. So therapy is kind of unique. um, Majority of what you say here stays into therapy, but we do have limitations. If you disclose any child abuse, elderly abuse, abuse of a vulnerable adult, I am a mandated reporter and I have to report that. Do I report everything you've told me in therapy? Nope. But I do report, what needs to be reported, your name, certain information that was provided. And normally I don't have to do that a lot. I do have to do a lot of evaluations, and part of the when I do evals, I'll ask people about their trauma history and they'll disclose. This happened to me when I was a kid, mom's boyfriend, a neighbor, whatever. And before that, I make them aware as well, what I have to report as a mandated reporter. Okay. And sometimes I don't have the name of the person who did it, but I still have to report it. Um, if you're having some serious suicidal, homicidal thinking for your well-being, for the safety of the community, I have to report that, to keep you safe and whoever who could be in harm safe as well. And I'm hoping that if you're reporting these things to me, that you recognize that, that you want help, you just don't know how to get it. And my job is essentially, bridge that gap. Okay. I want to make sure that you're safe, people around you are safe. And, how do we get there? You know, looks like probably breaking confidentiality, unfortunately. Also, if there's ever a court order, I've never seen one, but I know that they exist. Certain things can, the court may need. A lot of times I can get around certain stuff. But when there's a subpoena, a court order, there's going to involve some lawyers, and essentially, it's in your best interest. I'm trying not to do harm. Essentially, that's my goal. If there was ever a medical emergency, like you were in my office, and I need to call 911, I mean, just calling somebody, giving your name, your information, you're here, that breaks confidentiality. If you were ever to sue me for me to be able to defend myself, then certain information would be also shared. No, I couldn't go back and pull up all your records and use them against you. I would just have to do the best I could and move forward. So with that information, I do want to talk about records and how records are kept. So for the most part, when I keep records, I have most your basic information, things that we talked about, we processed, we addressed, but I don't go into a lot of detail of you said this specific thing, these certain things were going on, because, I understand that records can be subpoenaed. There could be court orders, and my goal is to protect my clients. I'm pretty good at remembering most things. Sometimes I'm gonna have to take some notes. But I think record keeping is more for insurance companies. They're to make sure that I'm doing my job and I can report properly to them without you know reporting too much and giving too much of your information away. Okay. Um, and when confidentiality is a big thing in therapy, essentially, they say what you say here stays here, but with those certain limitations. But it also talks about like social media. Like I can't be friends with people on social media. I've had some clients try and add me, and I have to really politely, redirect them and just say, I can't. It breaks confidentiality. Essentially, if I see clients in public, maybe at the grocery store, it does happen. I'm not ignoring you. I'm not pretending like you don't exist. It's just for your confidentiality. I'm not going to address you because I don't want you to feel uncomfortable, obligated. My family knows I'm a therapist and I don't want to give them any, indication that you're a client of mine. But sometimes clients will come and approach me and then I know, okay, it's safe. It's safe to talk to you. No, we're not going to talk about your last therapy session, but I am going to say hi and say, how you're doing, you're out with your family, it's good to see you. Okay. I think a big thing to talk about is grievances. People have complaints about therapy. They have a way to report things. I give them that information. Normally that involves a supervisor, the licensing board, anything like that, which has been used, as a way to protect clients. Okay. So as we get through all that information, normally it's about, 15, 20 minutes, depending on, how many questions they have, making sure that everything is pretty clear and they can understand stuff, for the most part. And then we got about half hour-ish where we talk about, what brings them into therapy. And depending on, if you're the emotional dumper or you're somebody who's very anxious and, it's starting to more, the anxious person, okay, we're going to start talking about maybe some small things. We're going to start building trust, building that relationship. There probably isn't maybe a lot that gets accomplished except for you feel more comfortable and you want to come back next week and you want to continue the process and you're starting to think about, okay, what are my goals? What are things that is important for me to address and to work on? The emotional dumper, normally there's a lot going on in life. They're extremely overwhelmed. They just need somebody to talk to, some kind of support. They just need to get it out. And that's kind of half of therapy, is just getting this stuff out, talking about it, hearing yourself say it, release it. Is therapeutic in itself, right? And sometimes people just don't have people in their lives who they feel safe to do that with. Um, so that's kind of, okay, we got a lot of stuff going on. Probably we don't get through even most of it. We kind of just get through the big things, but you can throw some really big stuff out there in therapy your first session. It's like, okay, I know our first session was kind of short. So that point, sometimes depending on the individual, I'll say, let's schedule in a few more days. Okay. Like, there's a lot going on. My goal is to support you, trying to work, through these symptoms, decrease them, manage them. Okay. And if that means, we're going to therapy twice a week, then we're going to therapy twice a week. That's okay. Most people I see, they need to just come in once a week. I have some people, every other week. It just depends. It's all individual based. I meet my clients essentially where they are, what their needs are, and we move from there. Okay. So I'm hoping this gives some people some idea of what to expect when you first go into your first individual session. I know when I did counseling when I was a lot younger, I had this idea like I was going to go in and I need to talk about all these things. But then I was like, okay, we just spent the first half of the session talking about, all the paperwork. I mean, that's not the fun stuff, right? And then I felt like I had very little time to really talk about, just kind of mention these things that are bothering me and not really like start to get into them. And I felt that was disappointing. And I think it's important that clients have some kind of idea, okay? But that's fine, even if it's not exactly what you're hoping for. I'm hoping that you've gotten something out of it, and it's like, okay, well, the next time it does get better. Therapy does get better. Normally, it takes the relationship between the therapist and the client to start to build, to have that trust and rapport. Um, having the time to deal with some of these big major issues that people are struggling with, and we get it. And unfortunately, our time is limited in how we do that. But we're going to try the best that we can. If you have any questions, please feel free to message me. And, I really hope that this helps somebody say, okay, I can do this. I'm struggling. I know I need to reach out. If I do it through telehealth, or if I can call a therapist, if I can schedule an appointment and just at least get this thing rolling and kind of know like what to expect, and then start that process. Okay. Well, thank you so much for watching my video, and you have a wonderful day.